Good morning, everyone. We're going to get started in just a couple of minutes. Having a couple technical difficulties, but promise will be just a couple minutes, just a minute.
Good morning, Holly. Are we ready to get started?
We are.
All right. Well, good morning, everyone. It is an honor to welcome you today to today's webinar. As trustee of the Opioid Crisis Abatement Trust, I could not be prouder of this group and of your commitment to one of the most pressing public health challenges of our time, the opioid crisis. This work is not only critical to the well-being of Georgians, but it's also truly life-saving. A statistic that many of you are familiar with, from 2010 to 2022, the total number of opioid-involved overdose deaths in Georgia increased by 302%, and a majority of those deaths came from fentanyl. Today, we are just beginning a new era in the fight against this epidemic. Today, we're beginning to continue to issue a warning about the effects of fentanyl and opioids, but we have a new tool in our toolbox, and that is the Opioid Abatement Trust. The grant funding you will receive will directly serve Georgians who have been impacted by the opioid epidemic and hopefully save future lives. I want to extend my sincere congratulations to our 128 grantees on their outstanding applications. We received over 300 grant applications last spring, which shows just how competitive this application process was. Your dedication, your innovation, and your tireless efforts will make a profound difference in the communities across our state. The funding awarded through this trust is not just about resources, it is about hope. Hope for individuals struggling with substance use who are seeking treatment, and communities determined to turn the tide on this crisis. As we move forward, collaboration remains key. The partnerships forged through this initiative between state agencies, local organizations, healthcare providers, and advocates are a testament to what is possible when we all come together for a shared cause. Through prevention, treatment, and recovery support, we are laying the foundation for a meaningful and lasting change. Thank you for your commitment to this mission. Your work today will save lives, restore futures, strengthen communities, and lead us to a better tomorrow. Congratulations again, and now let's get to work.
Thank you, Trustee, so much. So welcome, ladies and gentlemen. We are so glad that you are here and that you have been awarded an inaugural Opioid Abatement Trust grant. There are, 106 of you on right now, so we've got quite a group. But I want to again welcome you. My name is Holly Lindy. I am the Executive Director of the Georgia Opioid Crisis Abatement Trust. Before we get started, I wanted to ask if you have any questions, please go ahead and enter them in the chat. We are going to hold our responses until the end because we hope that we'll get through all of your questions during our content. So you've already heard from our trustee, Kevin Tanner, who's also the Commissioner of the Department of Behavioral Health and Developmental Disabilities. But I want to first start out by giving some other introductions. We've got Taylor Payton, actually she's just to my right and just waved. She's our opioid abatement liaison. She works directly for the trust. We've also got Melissa Malcolm. Melissa, you want to wave? There's Melissa. She is our opioid attorney. She is actually employed by DBHDD, but we are her one and only client. We're very pleased to have her. She is, both of these ladies are true gems in what they do. We've also got Brenda Woodard, who is DBHDD's general counsel. Brenda's been involved in the opioid work since the very beginning. We've also got Cassandra Price Bagley, although I'm actually not sure if she's on today. She is Director of DBHDD's Office of Addictive Diseases, and she helped set up much of the work that you're seeing the fruits of her labors today. And she is also a member of the GOSAC, the Georgia Opioid Settlement Advisory Commission. Sorry, there's lots of acronyms. And then we've got Vaughn Wrighton. Vaughn, you want to wave so everybody can see you? Yep. Vaughn is our director of DBHDD's substance use disorder initiatives, and he also manages our wonderful programmatic officers who hopefully you have been in contact with for the last few days as you have received your contracts. We've got Kaylee Brown, Ira Moore, and Frank Smith. If you have not heard from them, then there might be a problem, and please let us know. But you should have received your contract and gotten in touch with one of these programmatic officers. So I want to start really quickly by talking a little bit about the trust versus DBHDD. I mentioned that several of our folks on this call are DBHDD employees, but I want to make clear, crystal clear, that the trust and DBHDD are separate entities. While we do a lot of work together, the trust is only administratively attached to DBHDD, and the way we do our processes is different than DBHDD. You may or may not have been a DBHDD provider or contractor in the past or currently, but the way we do our contracting through the trust is different, and generally our practices are different. Our MOA, DBHDD and the trust have a memorandum of understanding that allows DBHDD to do some administrative work for us. For instance, Melissa's position is funded by the trust, but she is employed by DBHDD, and so she works specifically for the things that we do. In addition, our programmatic officers, again, are technically employed by DBHDD, but are funded by the trust. So our memorandum of understanding allows some administrative aspects to be administered by DBHDD, but it is for the purposes of the trust. I actually don't think Cassandra is on here. Originally she was talking about this issue of separate grant funding, so I do want to actually bring this up myself. So one of the things that's really important as you administer these grants is the issue of separating your funding streams. Again, you may have been and may currently be a DBHDD provider. However, those funds should not be mixed. Again, because the trust and DBHDD are separate entities. So you must account for your funding through the trust separately from the way you account for your funds from DBHD and any other funding stream that you receive. They must be separate ledgers. So with that, I believe I will turn it over to Melissa Malcolm to talk about some of the legal issues of your contracts.
Thank you so much, Holly. I appreciate the introduction. I appreciate everyone's attention and time today. At the outset, I want to make clear I am the trust attorney. I am going over some contracting basics of what you will find in your contract, but I am not your attorney. So this is not legal advice to you, the contractors, as you review and execute your contracts. But I want us to focus on some of these provisions to help us get to what I call a meeting of the minds. We are entering this wonderful partnership not true legal partnership. We're entering this work together to move forward and do the very important work of the trust. And I want us to be sure that we're on the same page and that we have a true meeting of the minds as we enter these contracts and move forward. So you should have already received your contract from your programmatic officer. And I wanted to go over what you have in your inbox. You have first the main contract document, which is around 20 pages, 31 sections, and that is the meat of the contract. You've also received an Annex A and an Annex B. Those are true parts of the contract, and they are just as legally binding on you as the main contract document. And then you have also received the reporting attachment 1. Now that's an example. It's not really part of the contract itself, but these are the examples of how we're expecting the contractors to give the quarterly reports as we move forward. So a little bit more about all of this. The 31 sections in your main contract document, please review and read all of this in its entirety. And you will notice that it requires a corporate or board resolution in order to execute. And that is very important. We know that y'all are, we want to be sure that we have the full legal authority, or that y'all have the full legal authority on your end to enter this contract, and it's not someone signing on their own, but we have the full board authority or governing body authority as you enter the contract. So what this is going to mean is that you'll receive, when you receive this packet, you'll see what those pages for the signature. You'll actually print those out and have that executed and have the corporate seal put on your contract after you have that authority, and then you'll email it back to your programmatic officer. You'll still do the e-signing, and then it will go through the process. So we're accepting the emailed versions back of your notarized signatures or your signature with the corporate seal, and we'll move forward and keep those on file in that manner. Annex A is where you're going to find the true nitty-gritty details of your contract. This is where your deliverables are, where the approved budget is, your site locations, more on that later, but pay very close attention to those deliverables that were put into your contract. And we want to be sure that we're on the same page as we move forward with that. Annex B is the immigration compliance. This is to show compliance with state law, and you need to pay attention to that. And if you're looking at the state law requires that employers of a certain size use the E-Verify program that's available from the federal government. And so pay attention, there's 2 options there, and execute the version that is accurate for your organization and send that back in. The reporting attachment, this has both the narrative questions and some structured report questions that you will be getting as the reporting moves forward for the trust. When you look at this, I do not want you to get overwhelmed by the reporting attachment 1, because it contains the questions for all of the subcategories of providers, and you will only be asked to fill out the ones that apply to your particular contract. So if you applied in prevention, then you will look at those particular questions, but you will not be required to report on everything that's in that reporting attachment 1. First and foremost, subcontracting and assignment are prohibited by your contract. So we know that there were a few of you who did let us know during the approval process, during the grant review process, that you would be providing your contract in conjunction with another entity. However, we only received all of the background information on your main organization. So subcontracting an assignment, having someone else do your contract is not allowed. But what we are going to do is, if you are one of those that let us know or you need to use a subcontractor for something, this will be handled in a contract amendment. So go ahead and let your programmatic officer know. We believe we are one of the ones that let y'all know we were going to use a subcontractor or a sub-grantee as we moved forward, and we will document that in this contract amendment on a case-by-case basis. Given the volume of contracts that are out there, it is possible that the amendment will not occur at the same time as your initial contract execution, but will occur in the next few weeks after that. We also want to make sure that we're in agreement on the delivery sites where your deliverables are going to occur or be delivered. You will find that if you are a direct services provider, so MAT or recovery support, that is going to require that address for deliverables is going to be in the main contract itself. And then if you have non-direct services, then those delivery sites are in the Annex A. So your programmatic officer has made a contracting choice from our main templates and selected the proper provision, and then your addresses appear either in the contract or in Annex A, depending on whether it's direct services or not direct services. Please look at these addresses. If it's a PO box, we're asking for your help to fill in an actual street address. So we don't want to rely on a PO box for the location of direct services. So we're going to be looking for that to come back with help from y'all to fill in those accurate street addresses. And then if y'all have additional sites, so we had the main contracting site or delivery site that was included in the application process. If you are intending on providing services at a different location, an additional location, we need you to let us know that in Annex A. So feel free to add that address and submit it back with Annex A. So you'll find this in Section 3B and Annex A of your main contract. Also, the contract term is limited. For the most part, the great majority are either 12 months or 24 months. All contracts will have an effective date of March 15th of 2025, and they will all expire on that anniversary date of March 14th, 2026. Or March 14th, 2027. So you can double check your contract term in Section 7, make sure that that is accurate. We have a couple of outliers. So we have a couple of 9-month contracts, an 18-month contract. And if you are one of those, that should be explicitly spelled out in Section 7. Also, while we're on the subject, the contract starts March 15th. We are not reimbursing expenses prior to March 15th. Expenses incurred prior to March 15th. So keep that in mind when you look at your contract term. It also means that if the negotiations extend longer, we're not going to extend the contract term past that anniversary date of March 14th, 2026 or 2027. If we're getting started later, then you're still going to have that same expiration date. Okay. For some deliverables, and this is in Section 6 and in Annex A, the deliverables have to be pre-approved by your programmatic officer. And these are the things that we just want to be sure that we are in total agreement on before they get out to the public. So that is a prevention campaign, if it's not already in use in Georgia. Media campaigns for which we did not receive exactly what that content was going to be when you applied for the grant, and vehicle purchases. We felt that these 3 areas of deliverables had the potential to raise questions or cause concern from the public, and we want to be certain that we all are on the same page before these campaigns go out. So for example, if it's a campaign, a prevention campaign that you've already been doing for DBHDD and you're extending this to a new audience, then that's not something that we're going to need to approve from the outset, because we already know what the content of that program is. So you'll see that that is in section 6 of the contract. And then in Annex A, your programmatic officer has these 3 choices, and it's either a yes or a no. We see that your contract requires pre-approval for one of these things. So that's where you can find your answer on how we are viewing your prevention and media campaigns and vehicle purchases. Affirmative duty to report to the trust. So one of the things that's included in your contract in the in section 18 is if certain events occur within your organization or to your key personnel or to the board members or officers of your organization, then we need them reported to the trust. And this is because we all want to be doing good work and transparent to the public. And if these things come up, we want to know about it as soon as you know about it. So if any of your key personnel, officers, or board members receive a charge of violating the law or allegations or certainly a conviction of violating the law or a regulation, we need you to report that to your programmatic officer as soon as possible. And there's a outlying deadline of 3 business days in the contract. Also, if the Medicaid or Medicare number is terminated for your organization, we need to know that. Or if your Medicaid provider enrollment number is terminated, we need to know. And of course, you're not providing Medicaid services as a part of this contract. And so, but still, if something has gone on in your organization that led to that, that is why we would need to know so we can address any potential compliance issues that are going on. If you discover or have a reasonable suspicion that the information that you have provided to the trust in any of your reports or information you've provided to the trust is fraudulent or misleading, let us know. Email your programmatic officer. Also, if you're advance the slide. If your board or your company has a change in ownership of more than 50%, so if your assets are purchased by somebody else, more than half of those, or the shares of ownership, or if your board membership changes by at least half, then we want to know that as well. Again, we have done our due diligence. Y'all have supplied your documents so that we know who we're working with. And if this changes, then that's something that we want to know. Doesn't mean that there's going to be a termination of the contract, but we need to know who we're working with as the trust. Also, the same thing, termination or replacement of key personnel. Or if you write or submit or agree to a corrective action plan with any state or federal agency or government that you're working with, we need to know you've entered a corrective action plan with even this other entity. And that's all in section 18, and we just wanted to go over that ahead of time so there was no confusion. Reporting. So with the reporting, obviously we need to make sure that we're getting, that the services are being provided and that we'll document exactly, you know, look at receipts and financials as we hand out the contract funds. So you will be reporting, we started off everyone on a quarterly basis, and we have made a change. So if your grant is over $500,000, you will be reporting quarterly. and receiving quarterly reimbursement. And if you are less than $500,000, then you will be able to report monthly and quarterly and receive the monthly reimbursement. And that's a big change on our part from the first meeting that we had till today. With the reporting, so the monthly reporting is going to be handled a little bit outside of the normal GMS system, and Taylor will be going over this in a bit. But keep in mind, since we're looking at reporting our successes on a quarterly basis and an aggregate of quarterly data, that what you turn in for the interim months will then need to be aggregated in the quarterly report. And I will let Taylor handle that more when she goes into reporting. Also, please do not send us PHI. Do not send us personally identifiable health information. We did not structure our reports to request that, and we're trying to keep our trust system free of any PHI that we would need to handle on that basis. So if you think it's asked for that, there's a misunderstanding of the report, and we'll help you figure out how to fill that out without providing PHI, because we are not asking for it. And I believe with that, I turn it over to Taylor.
Can you guys hear me? Okay, cool. So hi, I'm Taylor Payton. I'm the Opioid Abatement Liaison, and now we're going to talk about the Grants Management System, or probably you'll hear it referred to as GMS. So GMS is going to be the place where you enter all of your reports, all of your bills, and your budget amendments. You can access the GMS system through the same place that you submitted your application, through the gaopioidtrust.org website. Your login will be the same. Once you have signed and submitted a contract, you will have a For Awardees tab that will hold all these components. So who can use it? All individuals that were entered into your organizational profile when you made your initial application will be able to utilize GMS, as well as your programmatic officer, who will be accepting, denying all of your bills, reports, and amendments. Slides won't advance. Okay, they will. Reporting. So before I get into this, I want to let you all know we are recording this. I'll also be providing you with a series of videos that go over each of these components, as well as a written document that outline how to do each of these things. So as we said earlier, reporting will occur on a quarterly basis within the GMS system. If you are going to be on a monthly reporting basis, you will be getting a template that I created for you based on your program subcategory that you'll be emailing to your programmatic officer. But please keep in mind that quarterly report that you'll be doing in GMS must encapsulate all of those prior monthly reports to have a cumulative number within that quarterly report. So your quarterly reports are going to be due at the end of each quarter, or I'm sorry, 1 month after the end of each quarter. They're going to be based on your subcategory that you applied for. You'll also have milestones that will mimic your work plan and deliverables that you'll give us a short narrative for. And again, your programmatic officer will have the ability to accept or deny all reports. So now I'm going to go into the GMS system and show you exactly how to do that. But again, don't fret. I'll be sending you written instructions and videos and this recorded webinar so you can utilize that should you forget. So I'm going to leave the PowerPoint now. So here you're going to see, oh, I'm sorry, wrong one. Here you're going to see the portal. You'll see these For Awardees tab, and you should see your organization name here. For the sake of this, my organization name is Sunshine Recovery Center. So you'll go to the For Awardees tab, go to Project Reports, where I currently am. Here, you'll be able to filter all of your reports by their status. Oh, of course, it's reloading. Pre-reporting means that this is not yet open for reporting. It's too early from the due date. You cannot yet start a report. Non-compliant is going to mean that you did not submit your report by the due date. Please keep in mind, if you fall into a non-compliant status for any of your reporting, you will not be able to enter any invoicing for that reporting period and beyond. So please try to not fall into non-compliant status. Draft here is going to mean that this is now open for reporting. If you are a 1-year contract, you'll have 4 reporting entities. If you are a 2-year contract, you'll have 8 of these reporting entities. So here we'll go to this draft. You'll press this edit button. You'll have some preliminary questions that you'll answer. I'll show you those questions in the next slide. I should have showed you them before I did this. I apologize. You'll have some questions you'll answer. Again, you'll have to submit those into a Word document and then upload them. Here, you'll have some numeric questions you'll answer based on your project subcategory. So you would go to edit and then you could enter those responses. And then here, you will have your milestones. This again is going to be based on the work plan and deliverables that you entered in your application. To enter your milestones, again, you'll go to that drop-down menu and press edit, and you can give us a brief narrative of your milestone. Supporting documentation is where you can upload any documentation that shows us where you are in your reporting or within your program, and it can also answer those preliminary questions I'll show you back on the PowerPoint. So these are these preliminary questions. Again, I'm sorry, I should have showed you this before. So you'll answer these in a Word document that you will upload into the GMS system. Now billing. So billing, again, if you are an organization that has a budget of below 500,000 will occur monthly. If it is above, it will occur quarterly. You will receive reimbursements only for the line items that you establish within your contract. You must provide corresponding documentation for all requested reimbursements. Acceptable forms of documentation can include bid evaluations, purchase orders, invoices, sole source letters, payroll registrars, proof of payment, and receipts. So now I'm going to show you how to submit an invoice in the GMS system. So once again, you'll go to the GMS system. Under awardees, you will find a payment request tab. You can click on this. Again, you can filter based on the status of a current invoice, or for this, create a new. You'll select the project you are seeking reimbursement for. Enter the start and end date, and for the GMS system, since most of this quarterly, I'm going to do it 3 months out. 1, 2, 3. Press save. Sorry, this is taking so long, everybody. Oh boy, okay. And then once you receive this screen, you can press create. Here you'll have all the line items you entered in your application. You'll choose the specific line item you'd like to receive reimbursement for, add the amount you'd like to receive reimbursement for. It will show you the amount that you were approved for, as well as the amount of payments that you received for this item line. And so let's say I want to receive $200. You can press create. And then you can mimic that step for each line item you would like to see reimbursement for within this period. So now going back to the PowerPoint. I also took some screenshots of what this will look like. So when you receive these, you'll have those as well. So budget amendments. I know a lot of you received partial, receive partial funding and are going to need to do budget amendments based on your partial funding. So again, this is going to occur within the GMS system. You can only move funds from one line item to the next that you have already been approved for. Budget amendments are not to increase or decrease your current budget, just to move the amounts from one line item to the next. Again, changing your scope of work, if this is will be done with your programmatic officer outside of the GMS system. So now I'm going to show you how to do a budget amendment. Oh. So again, here you're in your GMS system, you'll go to awardees and budget amendments. Here you can filter based on the current status, but we are going to create a new one. So again, you'll select the project in which you would like to do a budget amendment for. You'll see all the line items. And I also would like to point out, so this is your total budget and your original budget. These two numbers must match in order for you to submit the budget amendment. If the total budget is in the red, you will not be able to submit the budget amendment. So we'll go here, press the line item you'd like to amend. Your total requested payments are the amount you've already received reimbursement for, so you cannot go below or past this number. So let's say we want to decrease this to 3,000. And I would like to add $3,000 to this specific line item, making it 18,000. You'll see that these do not match because I am $1,000 or I'm sorry, $100 over. So I'll go in to make sure that these numbers become equal and then press submit. Once these numbers are equal and you've pressed submit, your programmatic officer will have the opportunity to approve or deny your budget amendment. I am now going to pass it over to Vaughn for programming.
Hello, everyone. Thank you, Taylor. Thank you, team, for this opportunity to talk with you all today. My name is Vaughn Wrighton.
We can't hear you.
Okay, I'm going to try again. I know this thing is always difficult for me. Can you all hear me now? Can you hear me now? Testing. Can you hear me now?
I can.
Okay, so someone said they can. Can you all, Holly, can you all hear me? Yes? Yes?
Yes, Vaughn, you're good.
All right, great, 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 excellent, excellent, excellent. Thank you so much. Again, my name is Vaughn Wright, and I'm the director of the SUD initiatives and also the director of the GoCat contracts team. I have four elements that I want to speak with you all about that you'll be working closely with your programmatic officers on: site visits, technical assistance, quarterly reporting or monthly reporting, and payment requests. These are the types of things that we'll be looking at. So I want to share with you, first of all, what's important here about site visits. Your site visits will be annual and could be, it depends upon if as necessary. You and your programmatic officer will collaborate and coordinate on a time specific that works best for you all during your normal business practice hours at your site. It will consist of a site visit will consist of your review of your quarterly reports or your monthly reports and your payment requests. It will consist of your review of your agency's overall performances as it relates specifically to the contracted deliverables in your program proposal. Please know that site visits are not about "I got you" moments, but they're meant to assist in building your program's effectiveness as it relates to your contracted deliverables and the importance of the services that you are providing. That is the absolute thing that I want everybody to keep in mind, that the ultimate goal of a site visit is to ensure and to enhance the services that you are actually providing to the community. That's where we're always going to be operating from. So site visits may include the following: an audit of your fiscal accountability, a tour of your facility, meeting with your staff, meeting with some of the individuals that you're serving. During your site visit, your programmatic officer may offer some technical assistance services. Site visits will not include discussions about future plannings of the trust distribution or applications of that matter. Technical assistance. Technical assistance can be more formal or with other members of the trust team as well, assisting in programmatic issues. It really is about helping your program again get better, improve, share and exchange of ideas. Also, it's critical. Even now, some of you have already gotten your contracts, I understand. So technical assistance at this time may involve really working really hard to make sure that your deliverables are accurate, making sure that you understand the budget and some of the stuff that Taylor has already laid out to you, making sure you understand the quarterly reporting or the monthly reporting or the payment requests, make things of that matter. That's what my programmatic officers are designed to do and work with you on. But what is important, what makes this most effective is that if you take time to make sure and ensure that you communicate with your program officer, if they reach out to you by email, please, by all means, respond. If they call you on the telephone, please, by all means, respond in a timely manner so that we can move these contracts and get you to the place where you're ready to submit your programmatic reports and your payment requests in a timely manner. So again, that leads me to quarterly reports or monthly reports and to your payment requests. So if you fail to submit your quarterly reports, as Taylor was pointing out, at the proper time, you may get locked out and it will delay your payment process. Now that's not what we want to do. We want to make sure that that this moves smoothly. So your programmatic officers are the ones that will be reviewing your programmatic report and processing your payment requests. So getting these things done in a timely manner will certainly reduce the amount of back and forth and in helping us reach the final approval for your payments and all of those matters like that. So it is important. I need you to work very closely and as smoothly with your programmatic officer as possible. The smoother you all work together, the smoother the whole process will go. So keep in mind always that the ultimate goal is to serve the individuals that you all have so desire to serve. We want you to serve them. We need you to serve them. We trust that you're going to do a marvelous job. We want to do our very best working with you to serve those people. Thank you for your time.
Thank you, somehow, I really, oh. Sorry, we're having tech. There we go. Okay. Apologies, everyone. I, of course, had my speakers muted because Taylor is literally sitting directly to my right and has got her computer. We had feedback. Okay, so how to contact us. gaopioidtrust.org, which is, of course, where the portal lies. Our email address, gaopioidtrust@dbhdd.ga.gov. Taylor and I answer those emails, so you can reach us very easily that way. But really your first point of contact is your programmatic officer, Kaylee, Frank, or Ira. So they are your best point of contact. So I want to start going through some of the questions. I think we managed to answer most of them. So let's see, Carol, our grant funding is grant is funding a new counselor position. We're not sure. We'll have someone hired by the grant start date of March 15th. Thus, we won't be able to use 100% our funds. Is there any chance the no-cost extension will be available? Yes, no-cost extensions are available. That is not an issue at all. Just work with your programmatic officer towards the end of your grant and you can get that. That's no problem. I was told we need to submit an updated budget. Getting the 4 awardees tab. I only see 4 applicants. My understanding, I think how this works is once you sign so first of all, an updated budget needs to be done after you sign your contract because you'll need to do a budget amendment. So once everything is signed, sealed, and tied up in a nice, pretty little bow, you will receive access to the GMS to be able to do everything. That is my understanding. Correct me if I'm wrong. There we go. Okay, I got nods from Taylor and Vaughn. Let's see, move to monthly reimbursements. Yes, monthly reimbursements for contracts less than $500,000. On the so Melissa, this is a question from you. On the contract signature page, do we leave the section blank that asks for board minute certification if we're submitting a resolution in place of minutes?
Yes, that works. That's acceptable.
Okay, great. So yes, you can leave that section blank. Let's see. Our project, again, this is a Melissa question. Our project involves distribution of harm reduction resources to 9 health department clinics. Should we include all those addresses in Annex A?
Yes, I would like that.
Yes.
That's what we want.
So yes. For the PSA, do you just need a copy of the script? Vaughn responded to this. Work with your programmatic officer to discuss this in detail. So yes. To clarify, if our project is less than, you said $500, I assume you mean $500,000. Is it still acceptable to submit quarterly? Yes, if you would prefer to submit quarterly, that is fine. So yeah, that's not the first time I've had that question. So if that's easy enough for you, quarterly is absolutely fine. Let's see, let's do another question. If we don't see the awardees module, who do we contact? Our programmatic officer, again, just needs to be, you need to have your contract signed and everything buttoned up and tied up with a nice little bow before you'll receive that access. To clarify, do budget amendments need to occur prior to execution of the contract, or can those happen during the contract term? So budget amendments, as I mentioned a moment ago, budget amendments do need to happen after you've signed your contract. However, they can also occur at any point during the contract if you find that you're going to spend less on some line item and you would like to move those funds into a different line item. That is perfectly acceptable to do one later and more than one too. It's perfectly acceptable. Let's see. Okay, so everybody said they can hear Vaughn when I said I couldn't hear Vaughn. We are expected to move into our new location in the next few months. Do we need to give notice or gain approval for this certain amount of time prior to moving? So you do not need to give approval, well, how about this? What we need to know is, are you substantially moving the location of your services? Are you moving across the state? You know, if you're just moving within, you know, a couple miles, that's fine. But if you are substantially moving within the state, then we do need to have a conversation, because our assumption was that you were going to be providing certain services within a certain area of the state, and that could impact that could impact your contract. Melissa, is there anything you wanted to add to that? No? Okay. Let's see, how do we get GMS? How do we get access to GMS for team members needing to enter the reports and invoices? Again, I think.
You can add them to your, can they hear me?
Yes.
You can add them to your organizational profile. If you have any issues with that, you can reach out to me, but you should be able to, under the For Applicants tab, go to your organizational details and add any organization members to that profile, and then they should be able to access this. Again, this is all should. If you have any technical errors along the way, email me and we'll figure it out.
Yep. We've got a great contractor who built our system, and they're very responsive. Please walk through how to get to the awardees tab. I think that's probably an issue related to the 4 awardees. Again, you'll receive that once everything is signed, sealed, and delivered. Could somebody please explain the process for obtaining approval and payment for a vehicle purchase through the trust? So really what we're going to need, and Melissa, you can, well, actually, I should let Melissa explain this one.
So what we want you to do is identify what you wish to purchase and send those details, the price, the description of the vehicle to your programmatic officer, so that if we have questions or if it appears unreasonable on our end for some reason, we can go back and ask you more about that. So we're just looking really for a reasonable vehicle purchase, not something that's extra luxurious that would end up creating questions from the public. We're looking for a good use of funds. And so if you'll supply those details to the programmatic officer, then if we have additional concerns, we'll work back and forth with you. But that's what we're looking for.
All right, thank you. Let's see. Okay, we have monthly invoicing. Do we submit monthly programmatic as well? Yes, you will need to, because we made this change so late, we are going to have to do some offline processes with your reporting. You will be able to submit your invoices and your documentation through the portal, but we will need you to submit your reports, which will be essentially the same as the quarterly report. You'll just have to do it online. And again, you'll work with your programmatic officer to do that monthly reporting. Let's see. We provide scholarship assistance for sober living program fees to 31 programs throughout the state. Do we need to provide the addresses for all 31 programs? Melissa?
So it seems to me that the service there is the scholarship provision. I would not think, I'm answering no, that we don't need to know the location of everywhere that they're going, but we just need to understand where you are and you're administering that from. It's a little bit, that's different.
Yeah.
Yes.
Yeah.
Thank you for asking.
That's a great question. That is a very good question. Thank you. Once committed to monthly and quarterly reporting, are we locked in for the entire year with that arrangement, or can we move into quarterly reporting if we're financially able to do that? Yep, you can go from monthly to quarterly if that's what works for you. Again, just work with your programmatic officer. Just don't just don't, miss a quarter or two. You just need to let them know that you're gonna move. Yeah. So responding to the person who asked about moving, yes, 2 blocks over, that's no, you do not need any kind of permission. If you're just moving 2 blocks over, that's totally fine. Just let your programmatic officer know the new address for everything. Let's see.
Melissa raised her hand.
Oh, Melissa.
So on the monthly and quarterly billing, so there is a contract amendment that is required to do the monthly, and I should have gone over that in my part, but because we are changing how we're doing this, you have to sign a contract amendment to move from quarterly to monthly. So you can, so we'll need to document that if we're changing.
That's
It can
right.
happen, but it is more complicated than making a decision.
I apologize. Yes, that is actually one thing that we did forget. So all of your contracts that you received do say quarterly reporting, invoicing, and reimbursement. We are working on an amendment for all contracts that we will send out within the next week or so that will amend the contract to say monthly. Again, this is for all contracts less than $500,000. And yes, you're right. I apologize. We will have to re-amend the contract, but that shouldn't be a big deal if you want to go from monthly to quarterly reporting. So if you do want to start out though going to quarterly, just tell if you are less than $500,000 and want to start out as quarterly, just tell your programmatic officer you don't need to sign the amendment and you will just go with the contract as is. So, all right, next question. A large part of our grant is involving teaching a lesson plan on opioids to kids in over 100 counties. Will you need to do site visits to sit in on the instructors in the schools, or would it be acceptable for me to maintain the list of all the instructors? All instructors will be teaching the same lesson. I know, Vaughn,
I don't think we need to sit in on the site visits there. The site visits are more about your overall programmatic activity. And we don't need to sit in on those visits. The site visits will be come to your facility, understand your deliverables, and then even get some of those deliverables and see some of the activities if possible. So that would be something like that. We would not want to sit in with the people that you're actually training unless we decided to come out that particular day, and that is something that you and the programmatic officer have coordinated together.
Yeah. Thanks, Vaughn. Let's see. We're providing harm reduction distribution boxes, but do not have the exact location of where they're going to be across the region currently. Can I update this in Annex A as we get them established? Melissa says yes. That is not a problem. All right. When will be the last day to provide signatures for all contracts for the grantees? So there is not really a last date. We, of course, unfortunately, you cannot start submitting invoices until the contract is signed. So we would hope that you would do it as soon as you can, which is, of course, and then effective date is March 15th. So you can start submitting your invoices April 15th. So we would hope that we think it's best, of course, to get it signed as soon as possible, but there isn't a particular last date. We also recognize that, there are hoops that some folks have to jump through internally. Is there any consideration for monthly reimbursement for those grants over $500,000? We already have many contracts on monthly reimbursements. Quarterly reimbursements may impact cash flow. Tammy, thanks you for that question and comment. We will have internal discussions and let you know if that changes. If personnel is partially funded by the grant, are we able to submit a request for part of their salary with the pay slip as the documentation? Would any special reporting be required in such a case? No, as we mentioned in a prior slide, one of the acceptable forms of documentation is a payroll register. And if you just document that the grant is paying for 50% of their salary, you would request 50% of the reimbursement for that payroll register amount. So that's fine. Can receipts for reimbursements be submitted at any time, knowing they will only be processed at the end of the period? Or do we have to wait until the end of the period to submit them? No, you can submit them at any time. But again, won't be paid until you submit your quarterly report and then, or monthly or quarterly report, and that is accepted. Yes, Taylor has.
You can start your monthly invoices within the GMS system at any time and start uploading those documents if you want to get them ready. Your programmatic officer isn't going to see it or approve it until you press submit. So it will just remain in that draft status until you submit it if you do want to start uploading that documentation for each line item.
Section 5 of my contract says quarterly, so we need to get an amendment. Yes, as I mentioned, all contracts come as quarterly, and if your contract is less than $500,000, you will receive an amendment that says monthly. If you would like to continue reporting quarterly, you just don't need to sign your amendment, and you can just let them know. Let your contract officer, your programmatic officer know. We normally receive mail in the business office, which is in a different location or post box. Can we change our mailing address? I'm not entirely sure. So you normally receive your mail both in a business office and a mailing address. I'm not entirely sure. I think ultimately we need a street address. We need a street address at some point for your contract. But generally we're not going to mail anything. So I hope I answered that question correctly. Okay. We also received a couple of questions prior to this. That's another question that came up. Okay. Is there the ability to have over or under budget amounts by line item up to a particular percentage as long as the total funds don't exceed the total for the project? or any changes to the budget spending requiring a formal budget amendment. Unfortunately, our system does not allow for spending over your budget line item. So you will need to keep track of that. If you do anticipate if you do anticipate not spending a certain amount in a particular budget line item, you can move it to the other line item where you think you're going to spend over. But unfortunately, our system does not allow for any kind of percentage over the amount that you have been allocated in that budget line item. So I want to go over a couple questions that we did receive prior to the webinar. Somebody wanted to ask about slightly shifting the starting dates of projects, particularly for academic institutions. Your effective date will remain the same, which is March 15th. However, if for some reason, like you are an academic institution and you can't or won't start your project, let's say until the summer, that's fine to start it later. You will still have to submit those monthly or quarterly reports, and you just need to explain why you haven't spent any money, why you're delaying the start. And of course, an academic institution is very reasonable, but you just need to have that conversation with your programmatic officer. How do you want us to log the use of funds for scholarships? This was a question that we got. It kind of depends on the type of scholarship. So if you're talking training, we'd like to see things like the agenda, the names of the people trained, how much you would have spent per person for the training. But if we're talking direct services, we want to see things like maybe the client number, what they were enrolled for, the dates of enrollment, the cost of the service provided for them. But as always, work with your programmatic officer. Let's see. Grant start period. What is the foreseen schedule of refund of costs once forms and requests are submitted? So per your contract, we are obligated to pay your requests, your invoices within 30 days after approval by your programmatic officer. So let's see. Got a couple more questions. The employee that applied for the grant is no longer with us. How do we get the contact changed in the contract and on the website to allow access for grant management? Email Taylor.
Yeah, can you put my email?
Oh, yeah, you can enter your email.
Okay, I'll do it, yeah.
Yeah, Taylor will enter her email, and you can email her and she'll change it within the system. Can a vehicle purchase be paid up front by the trust, or does it have to be paid for the provider and later reimbursed? We will pay for a vehicle and construction costs up front. Again, we need documentation as to what that cost is going to be. So, the estimate, a formal estimate by the dealership or whoever, you're working with. Melissa, is there anything you wanted to add? No? Okay. I think we've answered all questions. Taylor, you want to enter your email address?
Okay. Right now that I'm done sharing.
Taylor is entering her email address. And again, as a reminder, this webinar will be posted on our website. We'll be adding a new page to the 4 awardees section once you receive access to that. And Taylor will also be posting the links to additional videos on how to do things, as well as step-by-step instructions. So we know this is all new for everybody, so please help us. It looks like, can we add both years' funds together for the purchase of a vehicle? I think you just talk to your programmatic officer about that one, because I'm not sure what that looks like. So work with your programmatic officer on that one. So that's great. Thank you, everyone. And it looks like Taylor is typing one last thing.
Yeah, I'm just to answer Martha. So all these resources are going to be posted on the website. We're going to add a component under the 4 awardees tab that will have some resources for y'all. So the videos on how to do a budget amendment, a report, an invoice, the recordings, and any other useful information we think you all might need. That will all be posted on the website under the awardees tab to come.
Yes. So, all right. Thank you, everyone. And please let us know. We're always here to answer questions. Thanks, everyone. Bye-bye.